Asbestos is a known carcinogen, and there's no safe level of exposure.
Mesothelioma is a miserable disease.
They must fight a truly global battle.
We want to demonstrate our enormous respect.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Keep me in your heart for a while.
Thank you for hanging in there. I'm really happy to be here. I was just coming back from Austin, where there's the Live Strong Assembly, and to tell you the truth, I wouldn't miss being here. Linda asked me, and I wouldn't miss being here because of not only the work that Linda and ADAO has been working on, but all of you on really. I understand about asbestos and mesothelioma, but you are a visionary organization that is taking the cause of environmental cancers to another level. And this is a big moment in time. I wouldn't miss being here, Linda. So it's really important to us and this country and truly the world. And all of you here who are both patient advocates and professionals are making a huge difference. I will note that in California, we'll have Proposition 29, which is actually a tobacco tax that would raise $800 million for research in California in the first year alone. So there is room for advocacy in our future. I don't think you know this, Linda, but the second reason I wanted to be here is that I've been with the cancer support community about 28 years. I'm a PhD psychologist and did a lot of support groups, about 6,000 of them. But I don't know if you know this, Linda, but the founder of what was then the wellness community, cancer support community, was a merger of both Gilda's Club and the wellness community. The founder of the wellness community in Santa Monica, California, died of pulmonary fibrosis. And I only learned this later, of course, that pulmonary fibrosis is related to mesothelioma. Dr. Benjamin, my mentor and friend, was a radar man in a B-52 in World War II, and they wrapped the wires around the radar scope with asbestos. So, so we're in a context where environmental causes are here, and the long-term effects we only learn later. And Debbie, I didn't know, I can't call you Muff Muff, I mean, it's a great name. I forgot Debbie, but I just remembered. You know, my wife and I, Susan is here as well. We were married in Plymouth, England in 1969. You were 10 years old. So we have a full camaraderie here. So I'll try and get through my slide deck reasonably quickly. I know you've been here vigilantly all day, but let me just make sure I can see this properly. So, great. So let's just set the landscape a little bit. The challenge of cancer today. Today there are more than 13 million cancer survivors in the US. That's 28 million worldwide. There are more than 1.5 million new cases diagnosed each year, maybe 1.6 million, it's getting larger. There are more than 77 million folks who are baby boomers in the US. That number is monumental. And yet the complexity of cancer, as you well know, has gotten incredibly more difficult. So you understand there's more screening, there's more testing, there's new tests, but really there's more treatment choices. And if you choose one treatment, sometimes you've precluded yourself from choosing another treatment. And then there are multiple recurrences. And what about, you know, comorbidities, you know, diabetes, cardiovascular disease? Put that into the landscape of what we're asking folks to manage. It's pretty amazing. And that there are more people and more need with fewer services. And what about costs? How about this week in Washington? Talk about advocacy. What about costs? They're overwhelming. Let's look at what we hear from our patients and members at the cancer support community. Nearly 9 out of 10 people report that there is at least one psychological or emotional issue that they are dealing with that is both physical and emotional, that is moderate to very severe. But what is the cost to the system for untreating the emotional issues? It costs the healthcare system about $8,400 more per person for untreated depression. This is a study with my colleague at the Department of Defense. $8,400 for untreated depression. And the kind of quote that I like to think about, it comes from the World Health Organization, and the idea of the whole person. And I like to read this because it's just meaningful to me. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that all cancer, it isn't just about the biology of the disease, it is about the psychology of the disease. All cancer care should include appropriate psychological and emotional support. So, and I think the world is recognizing that. I think you all here, living proof, really, to the testament to the needs of the survivor community and those family members. And it goes on, but there are a movement within the United States for sure that are identifying these areas of distress, particularly the Institute of Medicine report, Cancer Care for the Whole Patient, a big funding group within Washington, Patient-Centered Outcomes Research Institute, the American College of Surgeons, and American Society of Clinical Oncology are all recognizing the need for distress screening and standards on psychological and emotional care. Within that landscape enters the cancer support community. So a little bit about our mission. Some of you may know it, and others I want to just kind of let you know more about it. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We are not alone. We are in this together. And I think Linda and probably everyone here understands this particular pillars. But I want to place it in context. Leslie Crutchfield, who's a researcher in the US, wrote a book called Forces for Good. It's about transformational organizations, nonprofit organizations. And transformational organizations are transformative for 3 reasons. One is that they provide direct services, programs, education, a linkage for patients to get the support they need. 2, that the organization actually affirms and conducts research, and that there is policy and advocacy as an outgrowth. How can you make system change, as you're all describing, without that advocacy arm, without the patient group arm, without the education arm? And those are part of our 5 pillars. And I thought I'd show you within our network a little bit more. As I mentioned, the cancer support community was formed by a merger of 2 groups in 2009, the Wellness Community and Gilda's Club Worldwide. And we have a network of 57 local affiliates within the US, within Canada, within UK. We have partnerships with Maggie Center. I don't know if you know Maggie Center, Debbie, but we have partnerships around the world. And we have like 100 affiliates throughout the US. So if you add them all together, we're reaching about 750,000 people with cancer, 157 sites. We are by far the largest provider of psychological and emotional support in the United States, if not the world. This is what it looks like. It's a home-like setting. One's the Gilda's Club, another is the Wellness Community Building, and that one's in Cincinnati, Ohio. But I thought I'd give you a little bit more about what is it in God's name that we actually do, right? So first is we've developed for the last 15 years signature education programs called Frankly Speaking About Cancer, which provides an in-depth look into a variety of concerns cancer patients and their loved ones face following a diagnosis. But what's important about these booklets really are not just the education that they provide, but they're vetted by oncology professionals, survivors, and advocates. We're all in this together. The information we generate are for all of us. And that the programs themselves, the educational programs, are professionally led workshops and integrate psychological and emotional support as well as stress reduction. What we learned in some of our research, and that's the part that I bring into the equation, what we learned in some of our research, if you can reduce folks' anxiety and their distress, they actually can learn more and take the information and be actioned. Take actions that are essential to their lives. They'll more aptly talk to their doctor. They'll make changes in their life that are meaningful. We also have a very large web-based information network that reflects the innovations in the program. So the information's always updated. It's available online. You can always download it. It's all for free. All of our services and programs are for free, by the way. This is what the educational programs look like. Am I good, or? Yeah, great, sorry. Have to tune me into my slides. So this is what these look like. They're high quality, they're vetted. You'll see the one on lung cancer, of course, again, includes information on mesothelioma. They're print booklets, they're provided at face-to-face workshops, and there's online content that you can download. And a little bit more about our education and support. What happens when you go to a local facility, one of our local affiliates? There's a number of things that we provide. Face-to-face groups. We also provide telephone and online counseling, support groups, one-on-one counseling, nutrition and diet information, exercise programs, yoga, tai chi, stress reduction exercises as well, mindfulness, meditation, etc. All for free. So, just tomorrow, this is not April's Fool, but in April, first week in April, we are launching, are you all with me? We're launching for the first time our national helpline, to be launched right next month, first week. It's an advanced technological system. It's a call center that provides counseling and responding to all calls between 9 a.m. and 8 p.m. Eastern Time, 5 days per week. Counselors will provide support, make needed referrals to a database of over 800 national resources, and provide what's O2O is short for Open to Options, which is a decision support counseling program that's specially designed and researched, and I'll talk more about that in a minute. We have a very large e-presence. We've created and done research, first published research on the effectiveness of online support groups. These are professionally led support groups that are available in the UK through Maggie Centers. They're available in Canada. It's been adopted by Canada as the online support group model for the country of Canada through the Canadian Partnership Against Cancer. We have Group Loop, which is a teens program for teens not only affected by cancer, but whose family has been affected by cancer. We have a mobile app, iPhone and iPad, called Cancer Support Source that looks at distress, rates your distress. You can then sync up to programs and services. And you can also email your doctor if you need for follow-up about the distress you're having. We also have social networking through the usual media, Facebook, Twitter, you name it, blogging. I just did a blog from Livestrong yesterday. And we also have a very popular, frankly speaking, about cancer internet radio show that reaches 10,000 individuals each week, run by our CEO and president, Kim Thibodeau. So a little bit more about advocacy and policy, and I'll get into research, and we'll be able to kind of round this out. Policy and advocacy is new for our organization. Kim Thibodeau, as I mentioned, is our president and CEO, is beginning to reach into this arena for lots of different reasons. We're conducting advocacy and training for our affiliate network, huge network on the ground. But what's important about it, if you know about policy and advocacy, there's like an acronym for everything, and there's letters and numbers associated to everything, and very few people actually understand what that means. So we've been doing training on what in God's name does the healthcare bill actually mean? What are the components of it? We've been doing also hosting regular policy briefings. So if there's a new issue coming up, we've been hosting policy briefings. And on May 8th, if you're in DC, join us for a Hill briefing on the psychosocial issues and cancer with House Cancer Caucus. So we are moving into this arena, bringing to the foreground the needs, the psychological and emotional needs of people with cancer. And we're engaging with, now these are all acronyms within the U.S. healthcare system. CMS is 2 minutes, we should be fine. Thank you, though. The FDA, you all know, Health and Human Services. These are all organizations that we are interacting with, and we're asking to present to us what are their key issues. And in the 2 minutes remaining, I want to highlight some of the work that we've been doing at the Research and Training Institute. We like to think of the cancer support community as providing expertise in the cancer patient experience, because we've created the first institute of its kind in the U.S. dedicated to psychological and behavioral and survivorship research and training in cancer. And what is actually that we're doing at the institute? A number of things. We do peer-reviewed research studies on the importance of social and emotional support. That means it's about dissemination. Great research is done in the academic centers. How in God's name do we get it to the people who need it? We know that the lag, the chasm between research and delivery is 17 years. Can we shorten that span? Our lives, our families' lives, everyone's lives is dependent upon that. We do one-on-one interviews and focus groups so we actually capture the patient and family experience. We do national surveys and survivor registries, and we have professional training programs. A couple of projects that I think might be interesting for you all, and it might be useful as well, is one program called Open to Options. This is a project that was funded by the Center for Disease Control for 5 years, and it really focused on treatment decision-making for patients who are in high-stress situations. And we focus on the objectives that they seek. And in this study that we conducted in 3 sites around the U.S., we were able to see significant reductions in anxiety and distress, being able to ask better questions, and we generate a question list that they bring to their doctor. Some of those numbers are also part of the outcomes. But let's go, but how does it work? It's a one-on-one counseling program where people sit down with an individual or actually at our call center, and actually they generate the list of questions that they bring to their doctor. It's a roadmap for the doctor-patient interaction. Look, what happens when you walk into the doctor's office? If you're a patient, is the doctor standing? Is he sitting? Do you know whose agenda is it? What meeting do you ever go to? Would you come to this meeting if there wasn't an agenda in your hands of what's going to happen? Can you imagine what it's like to have a question list that's focused on the objectives that you have, that's focused on the concerns that you have, that you can actually talk to your doctor about? It creates the agenda for the patient and the family. The other project that I wanted to mention about is our distress screening program. We developed a first of its kind. I mean, you all know that there are distress screening measures, but this is the first validated distress screening tool in the community. 25 items, web-based, have HIPAA compliant, that we're able to measure the distress of patients in the community. And I'll close with this slide only because it's meaningful. The questions were developed linked to the evidence in the community. We didn't just make these up. We validated this among 270 patients in 10 sites around the US. And here are the studies and articles that go with this, so these will probably be online. And I thank you for your time and the great work that you're doing here. I'm so happy to be a part of it.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.